for Charlie Farm, Molocha. Farm, Molocha. Lonely one corner, Emma Lowry. Emma Lowry. Lonely two corner, Emma Lowry. Emma Lowry. Lonely three corner, Emma Lowry. Emma Lowry. Lonely four corner, Emma Lowry. Emma Lowry. Little Baiko, Emma Lowry. Emma Lowry. Nakarau, Emma Lowry. Emma Lowry. Loke Popo, Emma Lowry. Emma Lowry. Lisa Leko, Emma Lowry. Emma Lowry. Malo pe, malo wow. Malo wow, malo wow, malo wow, malo pe. Don't check for mommy. Oh yeah, I swear to God, right to party, oh wow. Oh yeah, come malo pe. I'm a kilo share now, I need Baba pe. Don't bother to do wow. Baby kilo day now, I will get sleep. Baby me love wash your kasa Johnny Male, katu shaye kai. Kamene simeti, kamene simeta, katu pe party light. Kako wanu lolo kashe wono tu katu shere kere. Come boy se koko wa. Kashe were were. Efo ile fa on to lai, fa on to lai, fa on to lai. Efo ile fa on to lo, ile fa on to lo. Efo tile fa on to lo, tile fa on to lo, fa on to lo. Efo chale fa on molocha, fa on molocha.
Yeah, ẹ kálẹ́ o. Ó já sọ pé òun lè tò. Ẹ kálẹ́ ẹ̀yin bàbá mi ìyá mi Olúbádé, yes, àwọn ọ̀gá mi bí ni Araba Fẹ́mò. Ẹ káàbọ̀ sórí ètò ó já sọ pé kọ́nà. Mo wà níbí pẹ̀lú ọ̀gá mi kan. A fẹ́ sọ̀rọ̀ lórí ètò ìlera ní Nàìjíríà bó ṣe ń lọ wípé kò tẹ́ wa lọ́rùn bí àwọn èèyàn ṣe ń kú káàkiri. Ó já sọ pé òun ni ètò tẹ́ máa ń gbọ́ tó yẹ pé ètò bí ìlú ṣe máa da, ètò bí rọrùn ṣe máa bá tonílé àtòkò, òun ni ó já sọ pé. Èmi náà ni èmi ọmọ yín ni ó já sọ pé one and only. Ẹ káàbọ̀ sórí ètò. Mo ní àlejò pàtàkì tí ó dàbí ẹ ti mọ̀ tá ti jọ wà ní orí ètò rí. Àwọn ni Mr Pius Badejo, care consultant ni wọ́n. Àwọn tó máa ń ṣètọ́jú àwọn tí bí àwọn tí ń darúgbó àbí wọ́n ní ìtọ́jú nílé káàkiri nílẹ̀ United Kingdom. Àwọn ni Mr Pius. Now ọ̀rọ̀ tí wọ́n fẹ́ sọ lénìí, yeah, nice talking to you. You're welcome. Good evening, my viewers. With my very good brother here, who is Mr. Pius Badejo. He's a care consultant. He's going to be telling us about how the government and how our people can take care of the elderly one and vulnerable people in Nigeria, especially those who are unable to take care of their parents. Maybe you are abroad or you are engaged in one form of things or other. So he's going to tell us secrets and how we can take care of our and he's going to advise the government how they can inculcate the system into Nigerian health system so that it will be helping us. You understand? Welcome, sir.
Welcome. Thank you very much.
Yeah, that's Mr. Badejo for you.
Good evening, all our viewers and listeners. The purpose of this evening's program is the provision of care services to the elderly and vulnerable and disabled people in our communities across Nigeria. As we all know, this service is yet to be regulated over there, but more and more people are needing it, particularly for their elderly loved ones and vulnerable individuals that are challenged one way or the other, either mentally, physically, or in many ways. They may be needing complex care needs, which the government is not really providing through the hospitals that we have. One of the cogent reasons why this program is brought to our attention is the series of spate of reports of abuse that is taking place in Nigeria when people try to care for their loved ones. Someone came to my office in the middle of this week, precisely Wednesday, to, utterly dejected and sad that his 95-year-old father was maltreated because he sent down some amount of money, a very big amount of money to Nigeria to the carer that is looking after the dad, and with the view of that, the person will use it judiciously to, look after this man. And then he even told me that he normally pays this man handsomely every month in as a reward for doing this. What happened was that, unfortunately, this money was embezzled and he was shattered and unhappy. And then when I questioned him that, was this carer or this person professionally qualified to deliver that care, or was there an agreement for this care provision? Sadly, he told me that there were none, and that the person was just like a neighbor that they thought has good character and is helping out. He's been helping out for years, but what he has done really was quite a surprise and shock. Then I simply let him realize the fact that this is an unorthodox way of looking after an elderly person that is vulnerable. But unfortunately, we have no system in place in Nigeria to do this effectively. If this have happened in the United Kingdom or even United States or other parts of the world, except Africa, I would say, it will have been classified as an abuse, and the person will have been arrested and punished by the law. But unfortunately, there's no mechanisms in place for this. Then he now asked me if I can help to arrange for, this type of service for his father, because he's looking for is somebody who would treat this old man very well, handle him with care, and, because all his siblings, all of them are abroad, some in the United States, other parts of Europe, and here. So there's none really who can be there as a family member. I told him straight away that for him to have lived here for many years, he did not really think that it's because of the ineptitude of our leaders in government that have led this gap in community healthcare delivery. But having said that, he should realize the fact that if we have to start campaigning and reorganizing, or campaigning for the reorganization of healthcare delivery system, it's everyone's responsibilities. Not because it's a victim of circumstances in this regard, but he should join hands with us to support our innovation, so that all of us, at the end of the day, can benefit from an effective community care delivery system. He said he agrees, but right now his problem is, how can he arrange for somebody, a trustworthy person that can help him look after his aged father? I said, well, we can help, and we will help. So this story is an example of thousands of us in this part of the world who are having old people, aged people, and people that they may be young or middle-aged, but they are challenged one way or the other, and in health-wise, and they need somebody or a mechanism that can help them to be looked after, without our presence. Then how do we go about it? I gave a thought to this, and I came out with an idea that, okay, I want to take up this challenge, and I know that if I do, other people will follow suit. How do I do it? My thought led me to an idea which I think can be developed. So I sketched out a plan, and I concluded that the best thing to do is to replicate what I'm doing here as a care provider in Nigeria, but in an indirect way, by establishing a network of well-vetted, checked, and trusted providers on the ground. Because I know some of our people, they've been establishing like care home back home. But this I am of the opinion that if a proper network is established, and then if like a template that we use here can be followed, we can have a group of providers that can faithfully and diligently provide this type of service in Nigeria. But I know there are many challenges and intrigues concerning this sort of idea, because you have to design it to be in tandem with the Nigerian situation. You cannot, do it and expect a result which you will expect here because of the culture and behavior of our people. So I try to sort of identify some problems that we can encounter, both on the side of the providers and on the side of the beneficiaries of this service. And I've come out with a couple of ideas, which because of lack of time, I may not be able to share with all of us here on this platform. But in summary, I've been contacting some people whom I know that they've been establishing services in Nigeria, and some others that knows those people, know people that are currently trying to run that type of business in Nigeria, to see how we can all come together as a network. And then we have like an arrangement whereby we can put into practice all the quality checks, all the standards that are operative here, and abide by that, like sign a sort of joint declaration or agreement, a legal agreement, that when a client is recommended to us, we will abide by this code of conduct until we can get our government to, legislate and come out with a regulatory body that is credible enough to, monitor and police this service. So because of that, some responses have been coming through, and I know with time we will have, good numbers of responses that can establish a solid network, and we would, and then my organization would be charged with the responsibility of vetting them, reaching an agreement with them, and introducing them to clients that are based in Nigeria from here. And then we will try to establish some sort of sanctions through the removal from registration or list of these providers. If anything goes wrong, they cannot, and we will monitor them.
Okay, thank you. That is Mr. Badejo, and is the CEO of care company. What's the name of your company?
It's Divine Care and Support Services Limited.
Yeah, the CEO of Divine and
Care and Support
Services in United Kingdom, and then he has been trying to bring a good care system to our doorstep in Nigeria and in United Kingdom. So my own observation is the way Nigerian elderly and then children who are less disabled children that are, and then the vulnerable generally, the way they have been treated in Nigeria after the hospital services that are supposed to be what we call a checkup or a services that the government has to be, or private entity like its own has to be, if in terms of follow-up to our to the patients who are discharged from hospitals, to know how they have been administered, their drug have been administered, how they are treating them after the hospital services. I think we need it the way they are doing it in this country. That is why in this country people just don't die anyhow, and then our mother that are vulnerable, that you people in Nigeria, many people in Nigeria call them and tell them that they are witch, they are wizard because of the look, the way they look, because nobody is taking care of them. I think that's the system, that's what they are doing here, that makes you to look to see the vulnerable one, elderly one, even the those ones that are disabled, that they are feeling fine and they are looking fine. If you look at their age people in United Kingdom, America, where this system is being used generally, not like Nigeria. Although some of our people, like Mr. Pius Badejo, has been trying to do it in Nigeria, but what I heard about it is that most of them are, at the end of the day, they pack up the business because of lack of the system is not entirely supported by the government, and many people don't know about the system. So now that is why we bring the professional in, because it's not about doctor. We have best doctors in Nigeria, we have best nurses in Nigeria. It's not about doctor. Sometimes everything is not about treating you in hospital. Sometimes you don't need to go to hospital. He said it last time that we don't need to go to hospital. Basically, there might be a GP system, that is a community health system. Yes. That will be like first aid treatment before we get to the next general hospital. That's the way they do it. That's why, I love something about health system, how our people can be delivered from a bad health system. That is why Mr. Badejo is here. Thank you very much for coming.
It's my pleasure.
Yeah, I like to be coming to him because I know what, and then he's a very trustworthy professional in terms of when we are talking about healthcare system in United Kingdom. So, sir, what advice do you have for our people concerning the way this thing can be inculcated in the system? What do you think? And then I want you to educate our people more about the care system. There is hospital, there is hospital, maybe general hospital. What is the difference between the GP hospital and the community care system you are talking about? Are they the same thing?
No, they're not. We have the primary healthcare system and we have the secondary care system, healthcare system. The primary care system is community-based. That is care in the community, healthcare in the community. And of course, we have the general practitioners, the doctors, the pharmacists, and some other professionals like the physiotherapists that, community nurses, district nurses that, look after the health of people in the community. That is health care on the street. So it is this primary healthcare system that now, after due examination of any patient, will make referrals to the hospitals, which are the secondary healthcare system. So it minimizes hospital attendances. It makes it easier for health to be brought to the doorstep of people within the community, because in Nigeria, you have areas where even a credible general hospital is thousands of miles away from some communities.
So that is not everybody are supposed to be in hospital every time.
No, and then they don't even need to get to the hospital before they receive healthcare. So that is one primary thing we are trying to campaign about, that it's high time that the government consider doing this, for the benefit of our people. More so, when people goes to the hospital, or for any ailment, in order to make hospital beds available for others to use, some people people need to be discharged, and then from the hospital either to their homes or to a place like a care home where they can be receiving continuous support, and care. so that they will make room for the hospitals to accommodate new patients that need those beds. So it will be a situation whereby, the hospitals we have can handle, more patients of a higher priority.
Okay.
And those that are being discharged into the community, there must be a system whereby you have nurses, healthcare assistants, and even doctors looking after them in their own homes or somewhere like a care home.
Okay. So thank you, sir. I'm here once again with Mr. Pius Badejo. He's a care consultant in the United Kingdom, and he's doing fine. And then he's trying to educate us because I have a passion for health care of our people, especially in Nigeria. The way things are, it's like the government is not doing enough. We have a lot of professionals. Apart from doctors, we have administrators. Those who are very professional administrators that can tell the government what to do. But sometimes, what happens in Nigeria, as I usually say, because I work in hospital, why will you, doctor that's supposed, administrator should be an administrator, doctor should be doctor, medical doctor should be medical doctor. Sometimes you will find somebody who is not supposed to be administrator in terms of affairs in Ministry of Health, in health sector in Nigeria. That is why we are having this problem. And most of them, I just don't understand, because most of these people came to study or conference or seminar or have stayed in United Kingdom, United States, Germany, Italy, Europe, and then all these things we are saying, it's just like we've not heard about it before. But I think they just decided to leave our people in that situation. That is why we are crying out. Nigeria, there is the money in Nigerian system that they can vote into this kind of healthcare system. The governor of every state supposed to know this. You understand? The governors of every state supposed to know this. The commissioner for health supposed to know this. I believe this, what Mr. Badejo and some other people have been telling us, is that they can create even wealth, and then they can create employment when they start this program. You understand? Some people are ready to do this thing to assist. It's not that those who are the carer, those who are going to be taking care of them, the care assistant, they can get many people to work.
Of course. We can, the thing is that, you see, people can be trained to do these jobs very well, as we know here, they can be trained to deliver this sort of good care to people in the community. And as my brother have said, this will give job opportunities to other people who, will give them jobs to do. And as this becomes more popular, we will discover that there will be more trust and confidence in the health system, because there will be needless hospital appointments, there will be unnecessary death, of people, and people can live longer. Because look at, for example, here, you will discover that it is because of all these good measures that you find people living even up to 100 years or a little bit above before they pass on. So, and you will discover that there are less pressure on the hospitals here. We are not opposing a situation whereby it's only government hospitals that should function. Private hospitals too can function. But all we are calling for is regulation of this provision, both in the hospitals and in the community, so that the safety of everyone can be guaranteed. Now, I will want to remind us of the fact that most of us that has been abroad for many, many years, particularly most of us we are above 60 years old, going to our 70s, we are nearing an age whereby we will be retiring. And most of us, we want to maybe retire home. We've had beautiful houses built back home in hope that we will want to retire gracefully there and grow gracefully there. But the question is, will our children that we born in this system, are they ready to come over there and look after us? No, because they have their own future. And having enjoyed a lot of things in this system, most of us will be craving for an arrangement whereby they will enjoy their old age, being surrounded by people that they can trust, that can look after them. Even if they are going to pay for it, they won't mind. So if there are no arrangements in place now, how do we think we can get that later? It's difficult. So we have to think about this. We have to think about the future. We have to strive to put things right now. Campaign for things to be put right now in anticipation of the fact that we too can suddenly become beneficiaries of this good service later on. Because whether we like it or not, we are growing old, and may God give us, all of us, long life and good health. But it will come to a stage where we too will need this support and assistance. If they are not in place, if the culture is not established now, definitely most of us will not get it. And we don't want to be trusting neighbors, errand boys, house helps that are not really, dependable or trained. So that's why we are clamoring for this to become a culture now. And I think that even if our government politicians are not looking in that direction now, something can be started that will be like a pace-setting arrangement that will, attract their attention later on, if it is proper. That's why I've tried to come up with this idea of establishing a network of providers back home in Nigeria that will be well vetted and be instructed to carry out deployment and of carers or healthcare assistants to people's houses, or inviting or bringing them to a very well habitable environment where care can be provided for these people, in line with the standards we have here. Having proper training. I know a couple of individuals who have been here to, I've gone through my training and I've gone back home to do this. So by the time has come to get them assembled, have a dialogue with them, and then if anybody needs services for their loved ones here, they contact us. We will recommend them to this network of providers who are on our register to try and respond and provide them services over there. And we will get them into a legally binding agreement.
We're online.
Legally binding agreement to make sure that at least they don't veer out of our professional guidelines. So when something like this is established, with time, people in Nigeria will come to know about it. It's either some people to organize other type of network like that, because Nigeria is a very big place, and one organization cannot do it all. It will come to a time that people will be replicating this idea. And when this is popular, it will be much more easier to get the government to consider the establishment of a proper regulatory body and framework to inspect and police this service both in the community and in the hospitals, as they do here.
Thank you, sir. Yeah, this is Mr. Badejo. Once again, he has been telling us about the issue of community health, and then how we can care for our parents back home. Especially, I bring Mr. Badejo up because of his efforts in making sure that our parents back home, especially those who are abroad, who don't have anybody to be trusted in Nigeria to take care of their loved ones, their family, their friends, their brother who are sick. Even anybody that is sick or that has been discharged from hospital, they will still need another medical. Is this social care?
Yeah, health and social
care. So that is why I'm trying to employ our people, our viewers. Help us share this so that many people can enjoy. I have somebody, Nancy Shani, online. She's from Adamawa. She has a big care home in Adamawa. She's trying to let people know what it takes, because she take care of the elderly ones and those who are vulnerable. She feed them in the morning, in the afternoon, and in the night. And if they are maybe when they are sick, she has to take them to the hospital, and then when they were discharged, she will be taking care of them. A lot of things that the care company do for our people, you understand. So like Mr. Badejo have said, he has a network that is working on about the social care service, social health care service for our people in Nigeria, and then in diaspora, wherever your parents are. If you need a care, you can contact Mr. Pius Badejo. Can you give them your information? Anybody that have any of my viewers, even if you are just watching me for the first time, and this is Mr. Pius Badejo, you have somebody that is looking for someone to take care of their parent, or their brother back home in Africa, in Nigeria, or even in United Kingdom here. I think he has he's capable of doing it, and he has his networking. Those who can help you in Nigeria, even if you are living in Nigeria and you don't have time to take care of your parents after the hospital, he can arrange from his own organization and his own network to take care of them. He's going to give you his own information now. So after the service, after the program, you can call Mr. Pius Badejo. I'm vouching for you, for he's a very good person and professional when we are talking in terms of care healthcare system. He's a trainer. He has been training a lot of people, as he has said. He has trained a lot of people. They are going to Nigeria. Many people have been going to Nigeria, including him, to go and do this. While they are doing it here, they are trying to do it in Nigeria. He's going to tell you much about him, how to get in touch with him, or if you have anybody that needs care back home, you can refer the person to him. He's going to give you the details, and then help us share this program, share it, and then his own Facebook page is his Facebook page is what? Olubade. That is his Facebook page. You can, if you want to get in touch with him, you can go and request, and then he will add you, so that if you have any thing that you want to talk about. And I've pasted his phone number. I've pasted it on the online there. You can see Mr. Pius. If you want to talk with him privately, personally, you can get in touch with him. He's going to tell you more about where you can get them, and then where they are operating from, and where they are. He's going to tell you.
Thank you very much. The name of our company is Divine Care and Support Services Limited. We are based in Camberwell, Southeast London. Our website is www.divinecaresupport.co.uk. www.divinecaresupport.co.uk. And you can email us at info@divinecaresupport.co.uk. All enquiries will be taken in strictest confidence, and we will make every effort to match, depending on which area of Nigeria your loved one or someone you want us to assist and support in finding a credible provider of care services to resides. I mean, states, or it could be states, or local government area or whatever. But we're trying to, and our register keeps on increasing. Will be increasing by the day. We'll be reviewing them, and then be giving updates about them. And any provider we found wanting, or it's not really operating according to our guidelines or agreement, we will put them off our register, and we'll come on a platform like this to announce to everybody that we no longer bear responsibility concerning our engagement with them or the referrals. Or if we find out that there is any form of professional misconduct, we will, remove them from our register and put people on notice that they are no longer our credible provider. It's just to make sure that we don't just introduce a provider or connect a provider to a service user, and then that organization will be taking advantage. No, we won't allow that, because we'll be having an agreement with them to operate according to what operates here. And most of them, of course, are people who have resided here before. So they know, and they themselves have even worked as a carer for many, many years before, establishing such services at home. So while we are doing this, we know there is still a loose end, because there is no official government regulation, as I've said. But we will be campaigning vigorously, using our platform to campaign, to persuade the government, our legislators, our lawmakers, to look at that side, to look into how they can help us regulate, care provision for the benefit of all. It's just for the safety and benefit of all. Because remember, we too, we are growing old in this system, and most of us do not want to, be here in their old age, because they rather enjoy retiring home gracefully. But the question is, what will they be retiring to? Is the unknown, if nothing is done now to establish a culture of a credible professional care provision over there. I have information that care provision is operating successfully in Ghana and Zimbabwe. And I believe that is because the authorities there have decided to support the initiative of entrepreneurs who have come back from abroad to establish these care services for their people. But the case is not like that in Nigeria at the moment, because the few providers I know have only registered with their various states' Ministry of Social Welfare, Youth, Sports and Social Welfare. So it's just simple registration. There are no regulations, and regulation is very important, because when you don't get these services inspected, how are you sure that people are doing what they are supposed to do? So, and we cannot leave the fate of vulnerable people in the hands of unscrupulous operators. So that is just the situation. So if you go to our website, you can go to Contact Us, where you will see our email platform, our message. You can put some messages there. We will get back to you as soon as we receive this. Or alternatively, you can text us on 07404137238, or email us at info@divinecaresupport.co.uk. Thank you.
Yeah, thank you, sir. My viewers, ṣé ẹ ti gbọ́ nípa care ìtọ́jú fún àwọn àgbàlagbà àti àwọn tó kù díẹ̀ káàtó fún tí wọ́n ṣe àìlera nílẹ̀ Nàìjíríà. A rí i pé kò wọ́pọ̀ rárá. Àwọn èèyàn wá ń gbìyànjú, ṣùgbọ́n most àwọn èèyàn tó máa ń lọ Nàìjíríà, èmi ìpàbó ni ìgbìyànjú ẹ̀ máa ń bọ́ sí, especially tán bá ti tiraka láti kó gbogbo owó kó equipment lọ Nàìjíríà, nítorí pé kò sí ìjọba òfin tó dá láti gbé lẹ́yìn, tó jẹ́ pé gbogbo a lè máa lọ nírọ̀wọ́rọ̀sẹ̀. Oníkálukú kàn ṣe tiẹ̀ ni. Àwọn náà ń ṣe gbogbo àwọn nǹkan táwọn náà ń sọ sí ni pé gbogbo àwọn kinní bọ́n ṣe ń ṣe yìí kò jẹ́ kí ó wúyàn lórí bí wọ́n ṣe ń ṣe nílùú bòmíì, pé ìjọba òun la ń pàkíyèsí ìjọba ń sórí ẹ̀ náà la ṣe pè wọ́n wá. Kí ni bí ó ní ó ti mẹ́hẹ̀, nítorí pé mo mọ̀ a lot of carer tó yẹ pé wọ́n mọ̀ pa health care system nílùú ìtàn lọ Nàìjíríà tán dálẹ̀ tó yẹ pé at the end of the day gbogbo ẹ̀ kàn bọ́ sí pàbó ni kí ni nǹkan tó ṣẹlẹ̀ tó fi bọ́ sí pàbó òun náà ni à ń béèrè lọ́wọ́ wọn. Now I want to ask you, sir, why is it that everybody that do this business or do this healthcare system in Nigeria, why is it that it's not working, it's not profitable, and it's not working like it's happened in other countries like Ghana? And I want you to tell us again. That's why I'm asking, because if people can hear this, maybe the government officials can hear this and know what to do. Why is it not working in Nigeria? Why is it working in other countries like Ghana and other places?
Thank you very much. The reason is simple. You see, when a business is established, you have to consider the environment where it operates. So the environment that a business operates in determines its success or failure. I'm afraid the environment back home is very, very hostile for businesses rather. When people establish such business, a lot is at stake. For example, from the side of the client themselves, you find out that some people, they will patronize the service with the intention of defrauding the service provider. They are not sincere. They will come over, try to reach an agreement that a service provision is needed, and try to pretend as if they will cooperate. For example, they might give a down payment of 6 months for their loved ones, get the person registered, get the person properly settled within the care home. But you will find that they will abandon that person. They will never come back to pay after the expiration of that one. They won't continually pay the service provider. And here is a vulnerable person being put in the care of a provider, and suddenly the provider is not getting paid for the service. The dilemma is this: on ethical principles, do you want to suddenly put somebody that is vulnerable and weak outside because no one has shown up to pay for them for the service? And at the same time, will you keep on spending as an entrepreneur on that service without, how will you pay your staff? How will you cope with your overheads? Not talk less of profit. So these are the strange dilemmas, and our people are very much in the habit of absconding.
But in that case, in that situation, if the government is aware about the business, about the healthcare support system, if there is healthcare support system for people of that nature, if the system is really working, can the care provider, can they write to the government and report the issue?
In the first place,
if that system is on ground.
Okay, yeah, yes, thank you very much. Number one, if the government supports the initiative of regulating the service, okay, the providers, it means the providers are being officially recognized by the government.
Yes.
So the providers too can, present a case of being well protected by the law, of what to do if, for example, there's a default. How can they be well protected about what they can legally do? What can they do legally to protect their own interest?
Okay.
Yeah. So, and in that case, as I said, even if they have to, you have to have a regulatory framework. If we have to provide care services, it must be in tandem with the Nigerian environment, the culture and the people.
Yeah.
We are not saying we should export to the place 100% of what operates here, because there are two different societies, different culture, different people. But we will take into consideration the risks involved. And everything will be done in realization of the risks involved. And that's one of the things I will be discussing with prospective collaborators as to, okay, if things like this happen, what can we do? So we have to sort of mitigate a lot of risks.
Okay.
We have to mitigate risks. That's what they do here. It's not that this system is perfect. It's not that they don't have their challenges.
Yeah.
But what they always do is to mitigate risks. When they mitigate it, they reduce it.
Okay.
With the intention of reducing it. So we too can succeed on that line.
Okay.
We will consider our own peculiar risks that are peculiar with our own environment, mitigate it,
Okay.
assess it, and then we'll put in place measures to reduce it.
Okay. All right. Nancy is saying, yeah, is one of the carer who is a care consultant also. She left, she's in UK. She has a day center. It's a charity free for age of 75 and above.
Yeah.
I've saw the video. It has been in existence now for almost maybe 2 years. People eat free. And I told her, how do you manage it? Because it will get to a stage you won't be able to survive. That is what we are saying. The government don't even know how they are treating their citizens. Someone just put up his money and starts feeding people. You understand? Now you start feeding people, you start admitting people to eat. But what advice do you have for this kind of person? Is in Adamawa. The care home is in Adamawa.
Yes.
What advice do you have in a short form? What advice do you have for
Yes,
him, for her?
Okay, yeah. Many thanks, Nancy, for your good work in that area. That's very good. A day center is simply a recreational center where people can come during the daytime to socialize, enjoy themselves, and go back. So yeah, we have them here as well.
Yeah.
Yes, I can understand her challenges, her concerns, because if you are running an initiative like this with your money, you can only do a little bit, because you will discover that there are a lot of people who will turn up, but you cannot provide more.
No.
You see, however, she can legitimately seek some fundraising initiative.
Okay.
There are some international funding agencies that she can approach.
Okay.
I know quite a few of them.
Okay.
I can advise her on some of them.
Uh-huh.
So, because when they see the evidence of what she's doing on the ground,
Yeah.
I'm telling you, they will genuinely support her. And because they will see the benefit of these facilities to the community,
Yeah.
where it's been cited. So they will support her. So I may need to get in touch with Nancy to discuss that.
Okay. Yeah.
But if there are similar initiatives elsewhere,
Yeah.
yes, we can get in touch.
For anybody that my viewers, this is Mr. Badejo, is the CEO CEO of Divine Care and Service
and
Support Services UK. Is a care consultant. In case you need to, you have a friend or family or which well-wishers who need to be taken care of. Maybe you are in your absence, you understand, and then maybe your family or other people, friends, you are not satisfied with the way they are taking care of your brothers, your sister, your uncle, your mother, your father, maybe back home in Nigeria, even in UK here. You can get in touch with him. The number is his number is +4474 04137238. His number is there for you to see, and then before we leave now, because we're about to go, if you want to call in to ask any question, you can call in. We have only 5 minutes to go. We have only 5 minutes left. Anybody that wants to call in can call a number. The number that you can call is on screen there. But after the program, you can call Mr. Pius' number. to get more information and to get to find out how to go about it if you have anybody to, or if you intend to go.
I think Nancy is trying to raise a question. So
Yeah.
why did you?
Okay.
We
Adamawa in the north. No.
Oh, okay, in Southwest.
I will have
someone is raising the question.
In
Southwest. Well, let me answer that
it
question.
will have been useful for us in Southwest.
Yes.
Akim, Wale.
Yeah, if I can just chip in a little bit.
Okay.
Mr. Akim or Mr. Victor Kenny.
Yeah.
Well, it's very good you raised that question. Well, this person, the reason why I think she has bothered to do that is for her community, members of her community. And since you have appreciated the usefulness of these facilities there, I would say let us all feel challenged and feel encouraged to replicate this good initiative in our areas. And we will see the benefits. Quite honestly, there are good funding opportunities for this kind of initiative, particularly on the international level. Because what these people are looking for is evidence that actually we are helping less privileged people and other people, so we should try and commend Nancy for her good work. And for the Southwest, of course, I know that a lot of us, like my brother who really raised the question, we will make it available too for our people as well, as Nancy have done, And Nancy too can support us with ideas, the practical ideas of how she's running that one there as well. So in that regard too, we can still benefit from Nancy's contribution to any one of us who considered it fit enough to establish something similar in our communities in the Southwest. Thank you.
All right, thank you, Mr. Badejo. Yeah, for all our viewers there, Nancy will recognize what you have been doing for your people. I think a lot of people are doing it in the north, but the only thing why we are doing this program is to enlightenment and tell our people that this thing should be real and there is supposed to be a legal and government backing so that it will be for general for every one of us in general. You understand? That is why we are doing even the Southwest. I know a lot of Southwesterner in Nigeria that have started this thing, care support for our elderly and then physically challenged people. And even in the north, some people like Nancy have been trying. But our own aim is just to educate our people and enlighten our people the importance of it, so that if you enlighten our people, some people can raise it up in Nigeria with the government and even with some NGOs. They can come together to form this thing. You understand? It cannot be one person. I don't think it's easy for one person to do it.
No, cannot do it.
People can come as a community and start this thing. And if government see what you are doing, and even as my Mr. Pius have said, if there are some NGO, international organizations that are supporting this kind of program, if they can see what is on ground, they will support every one of us. So let us bring this thing to Nigeria so that our people can get more job. You understand? Let us encourage ourselves so that when the government see, they will be forced to come in and ask of what we are doing. So our people have been trying. Mr. Badejo is there to offer you any advice concerning the healthcare system. If you want to go and start your healthcare system in Nigeria, you can get the training for him. If you need a consultancy advice, he can advise you and anything you want. So after this program, before we go now, we're about to go. If there's anybody to call in, he's going to just tell us brief about how to get in touch with him. And then if anybody wants to get in touch with Mr. Pius, you should do so. Mr. Pius.
Thank you very much. Again, our website is www.divinecaresupport.co.uk. Our email address is info@ divinecaresupport.co.uk. Thank you very much.
Yeah, and then the phone number is correct.
It's
isn't it?
correct, yes.
Yeah, and then if you want to get in touch with Mr. Pius, the phone number is +44 7404 137238. Again, +44 7404 137238. Mr. Pius is the director, or what will I call it? Is it?
Well, the registered
Yeah,
manager for
it's the register manager.
for
Yeah,
Divine
that's
Care
our
Support,
okay. Divine Care and Support.
.co.services.
.co.services.
No, Divine Care and Support Services Limited.
Divine Care and Support Services Limited. That's
yes.
the name of the care company.
Yes.
So, Mr. Pius, thank you for being with us. Thank you for
well.
your every time educating. Yeah, I'm still going to come once again with Mr. Pius whenever there is a new development and there is new thing to tell our people concerning and our government concerning how to take care of our people in Nigeria entirely, in Southwest, in North Central, in Southeast, in South Nigeria. Everybody in Nigeria deserves a good health system. So that is why we are here. We encourage the government to look into it. Healthcare system should be provided for everybody in Nigeria, irrespective of who you are. So far you are a Nigerian citizen, that is paramount. It's paramount, isn't it?
Yes, absolutely.
Yeah, to everybody, especially our old ones that are back home. And then if you have a elderly person back home, please take care of them. And then any physically challenged person in Nigeria, please don't neglect them, please. Thank you very much. It's Ojasokwe. I'll see you some other time. Thank you for joining us. Thank you very much.
Thank you.